Hello student, welcome to the lecture on health indicators, and after this lecture we will be able to learn the following objectives. Discuss on the importance of measuring health status, understand what influences health, explain the evidence based on health determinants. Let's start with the introduction. Health is defined as a state of complete physical, mental and social well-being and not merely the absence of disease or infirmity. The World Health Organization. It is an essential objective of development, and the capacity to develop depends on health. That is, health and development are interdependent, and health status cannot be traded off against economic gain. Wealth cannot buy health, but health can buy wealth. Many factors combine together to affect the health of individuals and communities. Whether people are healthy or not is determined by their circumstances and environment. To a large extent, factors such as where we live, the state of our environment, genetics, our income and education level, and our relationship with friends and family all have considerable impacts on health, whereas the more commonly considered factors such as access and use of healthcare services often have less of an impact. In this context, we examine health indicators and their determinants with special reference to India and also the importance of vulnerability and healthcare. The aim of indicator package is to bring together information on health and factors affecting health in one easily accessible place. It can be regarded as a dynamic supplement to update the package as relevant new information becomes available. The key health indicators theme is split into three sections: population, determinants of health, health indicators. Let us now discuss importance of measuring health status. If we want to understand the most important global health issues and what can be done to address them, then we must understand what factors have the most influence on health status, how health status measured, and what key trends in health status have occurred historically. Health status indicators measure different aspects of the health of a population. Examples include life expectancy, infant mortality, disability or chronic disease rates. Importance of health status and vulnerable groups. The capacity for survival in the prevailing socio-economic condition is accompanied by adaptation to a poorer quality of life, increasing undernourishment as all age groups, particularly mothers, infants and children. The technology and healthcare available appears to be able to sustain and prolong life in condition of great deprivation. The proportion of babies with a low birth weight in a poor country with a relatively very high life expectancy is an alarming evidence of this phenomenon. Meaning of vulnerability. Vulnerability refers to a condition to which the physical and mental well-being required for a normal productive life is impaired and at constant risk. In general, it refers to any conditions of exposure to hazards, risk and stress, and the poor health provides an initial entry to this condition. The pattern of morbidity, mortality and reproduction reflects the health-related vulnerability of individuals and communities and other products of various forms of social and economic deprivation acting simultaneously. Defining health status. Health status is grouped into following four clusters. The first cluster consists of the following: the types of diseases, their incidence, the rates of morbidity. It helps in defining the prevailing patterns of morbidity and identifying the disease that causes the major health problems. The second cluster relates a condition immediately antecedent to disease such as malnutrition or undernutrition in its various forms, obesity, low birth weight. The third cluster relates to the mortality indicators. The fourth cluster relates to the process of indicators and included those which relate to the processes that contribute to health status outcomes and human development. Key health indicators. Life expectancy at birth. The average number of years a newborn baby could expect to live if current mortality. Maternal mortality ratio. The number of women who die as a result of pregnancy and childbirth complication per 1 lakh live births in a given year. Infant mortality rate, the number of deaths of infants under age 1 per 1,000 live births in a given year. Neonatal mortality rate, the number of deaths to infants under 28 days of age in a given year per 1,000 live births in that year. Under 5, mortality rate, child mortality rate. The probability that a newborn baby will die before reaching age 5 expressed as a number per 1000 live births. Let us now discuss another topic. What influences health? There are many factors that influence people's health, and they are known as the determinants of health. These factors are often interactive and outside an individual's control. Determinants of health. Health determinant indicators measure things that influence health. Examples include diet, smoking, water quality, income and access to health services. First, nation also consider language, culture and spirituality to be health determinants. The determinants of the health include the following: the social and economic environment, the physical environment, the person's individual characteristic and behaviors. The context of people's life determines their health, and so blaming individuals for having poor health or crediting them for good health is inappropriate. Individuals are unlikely to be able to directly control many of the determinants of health. Following facts responsible for health status are: income and social status. Higher income and social status are linked to better health. The greater the gap between the richest and poorest people, the greater the differences in health. Education. Low education levels are linked with poorer health, more stress and lower self-confidence. Physical environment. Safe water and clean air, healthy workplaces, safe houses, communities and roads all contribute to good health. Employment and working condition of people in employment are healthier, particularly those who have more control over their working conditions. Social support networks. Greater support from families, friends and communities is linked to better health. Culture, custom and tradition and the beliefs of the family and community all affect health. Genetics. Inheritance plays a part in determining lifespan, healthiness and the livelihood of developing certain illness. Personal behavior and coping skills, balance, eating, keeping active, smoking, drinking and how we deal with life's stresses and challenges all affect health. Health services. Access and use of services that prevent and treat disease influences health. Gender. Men and women suffer from different types of diseases at different ages. Evidence based on health determinants. An evidence base about the impact that projects, programs and policies have had on health is required to carry out health impact assessment (HIA). The best available evidence is used within the appraisal stage of HIA to determine what impacts may occur, both positive and negative, the size of the impact if possible, and the distribution of that impact in different population groups. Providing a comprehensive review of the evidence base is not simple. It needs to draw on the best available evidence and including qualitative and quantitative evidence. This information must be supplemented with local and expert knowledge, policy, information and proposal-specific information. However, there are examples where the best available evidence has been documented and in some cases summarized. These are as follows: transport, food and agriculture, housing, waste, energy, industry, urbanization, water, radiation, nutrition and health. Transport. Evidence of health impact focus on accident between motor vehicles, bicycles and pedestrians, particularly children and young people, pollution from burning fossils fuels such as particulates and ozone, noise from transportation, psychosocial effects such as severance of communities by large roads and the restriction of children's movement, climate change due to CO2 emission, loss of land, improved physical activity from cycling or walking, increased access to employment, jobs and support services, recreational uses of road spaces, contributes to economic development, vector-borne diseases, food and agriculture. Agriculture production issues and manufacturing. Tobacco farming and its impact on heart disease, stroke, certain cancer and chronic respiratory disease, including passive smoking and impact of fetal development. Pesticide policies on tobacco crops require consideration. Changes in land use, soil quality, choice of crop, use of agricultural labor and occupational health, mechanization of work previously done by hand and plantation agriculture, fisheries, biotoxin, pollution, chemical use, wastewater, processing and occupational health, forestry, vector-borne diseases, occupational health and food security, livestock use, vector-borne diseases, drug residues, animal feed, waste and food security, sustainable farming including chemical and energy use, biodiversity, organic production methods and diversity of foods produced, fertilizer use, nitrate levels in food, pollution of waterways, reuse of agriculture waste, water irrigation use and its impact on river or water table levels and production outputs, pesticides usage and veterinary drugs, legal requirements, best practice, consumer issues, food packaging, preservation and safety and avoidance of long storage and travel. Access to and distribution of food. Household food security. Appropriate food being available with adequate access and being affordable. Location of markets, supermarkets and closure of small suppliers creating food deserts in cities. Food supplies including national and regional food security and regional production. National food security, able to provide adequate nutrition within a country without relying heavily on imported products. Cold chain reliability, the safety of transporting products that deteriorate microbiologically in the heat. Dietary patterns, diversity of food available and home production, particularly fruit and vegetable consumption and reduced stroke, heart disease and risk of certain cancer. Total saturated and polyunsaturated fat, carbohydrates and sugars consumption on obesity, heart disease, stroke and other vascular diseases. Alcohol consumption impact on social effects related to behavior, traffic accidents, work or home accidents, violence, social relation, unwanted pregnancy and STDs, and toxic effects, all-cause mortality, alcoholism, certain cancer, liver cirrhosis, psychosis, poisoning, gastritis, stroke, fetal alcohol syndrome and others. Micronutrients such as iron, vitamin A, zinc and iodine and their impact on deficiency syndromes. Food safety and food-borne illness hazard. Food and water are the major sources of exposure to both chemical and biological hazard. They impose a substantial health risk to consumers and economic burdens on individuals, communities and nations. Microorganisms such as Salmonella, Campylobacter, E. coli, O157, Listeria, Chlorea, viruses such as hepatitis A and parasites such as trichomoniasis in pigs and cattle, naturally occurring toxins such as mycotoxin, marine biotoxin and glycosides, unconventional agents such as the agent causing bovine spongiform, encephalopathy BSE or mad cow disease, persistent organic pollutants such as diogenes and PCBs, metals such as lead and mercury, new foods developed from biotechnology such as crops modified to resist pests, changes in animal husbandry, antibiotic use and new food additives. Housing evidence of health impacts focus on improvements in housing and improved mental health and general health, the possibility of improved housing leading to rent rises, impacting negativity on health, movement of original tenants after housing improvement and therefore not benefiting from the improvements. Waste, evidence of health impacts focuses on environmental and social determinants related to the transmission of agents of infectious disease from human and animal excreta, sanitation, hygiene and water related, exposure to toxic chemicals in human and animal excreta and in industrial waste discharge into the environment, environmental degradation, direct and indirect impacts on health, exposure to radioactive waste, exposure to healthcare waste, exposure to solid waste and involvement in informal waste recycling and breathing of disease vectors. Energy. Evidence of health impacts focus on health hazard such as fossil fuels, biomass fuels, hydropower and their impact on vector-borne diseases and pollution, electricity, generation and transmission, nuclear power, other energy sources, occupational health effects of energy workers, impacts on ecosystem, agriculture, forests, fisheries and building materials, noise, visual impact, global warming industry. Evidence of health impacts focus on industrial sectors such as asbestos and man-made fibers, basic chemicals, cement, glass and ceramics, electronics, iron and steel, manufacture of rubber and plastic products, metal products, mining, pesticides, paints and pharmaceuticals, petroleum products, pulp and paper, service industry, textiles and leather, wood and furniture. Urbanization. Evidence of health impacts focus on topics such as urban housing problems, city environment and non-communicable diseases, communicable diseases, road trauma, psychosocial disorders, sustainable urban development, urban waste, health services. Social determinants of health. In a rapidly globalizing world, millions continue to experience profound inequities in health, living, working and too often dying condition of poverty, exclusion and disenfranchisement. The greatest successes of health system reform, be it primary or abolishing out-of-pocket, have addressed the wider determinants of health inequities as a national priority, implementing reform through both policy changes and grassroots-based action. The World Health Organization Commission on Social Determinants of Health (CSDH) embedded the goal of universal health care in strategies that include improving daily living condition, tackling the inequitable distribution of money, power and resources, as well as measuring and understanding health inequities. The Commission 2008 report defines health inequities as systematic differences in health that are avoidable by reasonable actions and are quite simply unfair. It proposes to determine these systematic differences, that is, close the gap in a generation, the space of 30 to 40 years, through action on the social determinants of health. The CSDF defines the social determinants of health (SDH) as a condition in which people are born, grow, live, work and age, including the health system. It encourages countries to provide universal health coverage (UHC) to address health inequity directly. The report acknowledges, moreover, that health inequities arise not only from within but also from beyond the domain of health through other social determinants, including the unequal distribution of power, income, goods and services globally and nationally, the consequent unfairness in the immediate visible circumstances of people's life, their access to health care, schools and education, their condition of work and leisure, their homes, communities, towns or cities, and their chances of leading a flourishing life. It is already well established that among the most critical social determinants of health is the health system itself. In India, the movement towards universal health coverage (UHC) will necessitate reform of the health system. In addition, universal health coverage will only be possible if there is accompanying action on social determinants like food and nutrition security, social security, water and sanitation, work and income security, as well as social inclusion and equity across gender, caste and religious categories. In addition, macroeconomic policies in the country will also have a significant bearing on universal health coverage. Now, in the end, let us summarize what we have learned in this lecture. The aim of the MDGs is to encourage development by improving social and economic conditions in the world's poorest countries. The concept of vulnerability is implicit in the concept of health risk, which has always been part of public health. Health determinant indicators measure things that influence health. In a rapidly globalizing world, millions continue to experience profound inequities in health, living, working and too often dying in condition of poverty, exclusion and disenfranchisement. In India, the movement towards universal health coverage (UHC) will necessitate reform of the health system.